Low dose of aspirin is prescribed in patients with coronary thrombosis. This is also a very common question asked in the explain why section. This can be explained by the arachidonic acid pathway. In this pathway we see that membrane lipid, that is phosphatidylinositol, this will be metabolized with the help of the enzyme phospholipase A2 into the arachidonic acid. Now this arachidonic acid can be metabolized by two pathways. One is the cyclooxygenase pathway or the lipoxygenase pathway. This cyclooxygenase enzyme can have two isoforms, COX-1 and COX-2. Now in this cyclooxygenase pathway there will be so many intermediate products. One of the important products are prostacyclin or PGI2 and the thromboxane or TXA2. Now the thromboxane, it stimulates the platelet aggregation, whereas prostacyclin, it inhibits the platelet aggregation. Now at the low dose of aspirin, what it does, it actually blocks all the isoforms of cyclooxygenase. So as the cyclooxygenase enzyme is blocked, that means there will be inhibition of synthesis of both the prostacyclin as well as the thromboxane A2. Now thromboxane A2, it is produced from the activated platelets with the help of the enzyme COX-1, whereas prostacyclin is produced by COX-2 enzyme from vascular endothelial cells. So the site of origin of this thromboxane A2 and prostacyclin, it is different. Thromboxane A2 is generated from platelets, prostacyclin is generated from vascular endothelial cells. When aspirin inhibits the cyclooxygenase enzyme, so both the production of prostacyclin as well as the thromboxane A2, it is reduced. But soon after that, prostacyclin can be regenerated. It will be regenerated shortly from the vascular endothelial cell. But the thromboxane will remain deficient for a longer period of time. What is the explanation of that? Platelet, it is a blood cell which has no DNA. So it cannot synthesize any kind of protein, including the thromboxane A2. So once the platelet enzyme cyclooxygenase is inhibited, it cannot be replenished until newly formed platelets within the enzyme, with the cyclooxygenase enzyme, comes into the circulation. And it will take a longer time because we know the half-life of platelet, it is around 4 days. So normally there is a balance between the thromboxane A2 and prostacyclin. Thromboxane A2 helps platelet aggregation. Prostaglandin I2 inhibits platelet aggregation. So when there is low dose aspirin is given, what happens? Initially both the enzymes are blocked, but certainly after a short period the prostacyclin is regenerated, but the thromboxane remains deficient. As a result of that, there will be the balance between thromboxane A2 and prostacyclin. It is tilted toward prostacyclin. So platelet aggregation is inhibited, whereas vasodilatation and anti-aggregation mechanism via prostacyclin, it is stimulated, and this event is very much beneficial for the patients with the risk of coronary artery disease. Thank you students. Subscribe my channel.